Okay, so in this video I'm going to go through joints. A lot of things with joints are basically memorization, so this should be pretty straightforward, and it's just a lot of vocabulary terms for you. So articulations are going to be any point where two bones meet. So this is what you guys know as a joint. So we call this articulation. We classify articulations based on one of two ways, either how much they move or the type of connective tissue that they use to hold together. So if we classify them by movement, we have three different categories. Diarthrotic joints are freely movable. These are like your wrists, elbows, knees, etc. Amphiarthrotic joints are slightly movable. So in your back, your vertebrae are kind of slightly movable. Synarthrotic joints are no movement. So these are like the teeth in their teeth sockets. They shouldn't really be moving. The bones in your skull should not be moving. And then if we classify them based on the type of connective tissue holding them together, there's four categories. So fibrous joints are held together by collagen fibers. Cartilaginous joints are bound together by cartilage. Synostoses are bound together by osseous tissue, so bones. And then synovial joints are separated by something called a joint cavity. Synovial joints are the ones that we think of. These are like your shoulders, elbows, wrists, fingers, all of that. These other types of joints you may not have ever thought about. So, fibrous joints, there are a few different categories. Cartilaginous, a few different ones. Bony joints are on their own, and then synovial joints, there's a bunch. We'll go through each of these. So, a lot of questions that I like to ask on exams are true-false questions that basically come from this chart. So if you can find a way to memorize this chart and the arrows, that would be excellent for you on the exam. So we have the structural classifications on the left and the functional classifications on the right. So synovial joints can be diarthrotic, which is freely movable, or amphiarthrotic, semi-movable. Synovial joints will never be synarthroses. So a question I like to ask is, true or false? All synovial joints are diarthrotic. And you would say false, because they could also be amphiarthrotic. If I say true or false, all diarthrotic joints are synovial, you would say true, because they are all synovial. Okay? Fibrous joints can be amphi or synarthrotic. Cartilaginous can be amphi or synarthrotic. So the first type of fibrous joints are sutures, and this is your skull here. This is the top of your skull. Sutures are fibrous joints that hold two bones together very firmly. There's not much movement going on here. This is fibrous connective tissue. There are a bunch of different types of sutures. I don't care that you know the specifics of them, but just keep this in mind. The next type are called gumphoses. This is your tooth and your jaw. So this is held together by these periodontal ligaments, tiny little ligaments that hold your tooth in. And this has very, very little movement, but there is a little bit of give when you chew. Next type of fibrous joint is called a syndesmosis. This is your fibula and your tibia, which you guys should be familiar with by now. These are the bones in your lower leg. The syndesmosis hold these two bones together. They have a little bit more movement than a suture, so these are like amphiarthrotic. Same thing happens in your arm with your radius and your ulna. So cartilaginous joints, synchondroses, these are joined with hyaline cartilage. So for example, this is your sternum, these are your ribs and your clavicle. All of these joints are synchondroses. And then, like we talked about just a few videos ago, this is the epiphysis and the diaphysis. The joint holding the two together is a synchondrosis. Next type of cartilaginous joint is a symphysis. So, for example, the pubic symphysis that you guys should be familiar with now. These joints are held together by fibrocartilage. The discs in your back are also fibrocartilage. this allows for just a slight amount of movement. This pubic symphysis is probably synarthrotic, and in the back is more amphiarthrotic. Bony joints, so these are synostoses. These are completely fused together. So the example here, I know the arrow looks like it's pointing at the pubic symphysis, but we're more talking about the hip bone itself. So the os coxae is 3 separate bones, ilium, ischium, and pubis, held together, and they have completely ossified by adulthood. Another example, your jaw, your left and right mandible, are completely fused together. So these are bony joints. Synovial joints are a little bit different. These are the ones that we think of. So here's the bone, here's the other bone. In light blue is the articular cartilage that resists compression and absorbs shock. And then this purple is the joint cavity that contains synovial fluid. The innermost membrane here in like light purple is a synovial membrane that secretes the synovial fluid. And then on the outside is a fibrous capsule that is eventually the ligament once it wraps around here. Okay? Synovial joints are almost all diarthrotic, but some of them are amphiarthrotic. So the articular capsule is this outside. It's that fibrous layer and the synovial membrane. So this, as it continues, is continuous with the periosteum, which is the outer layer of the bone. The fluid in here is called synovial fluid. It's kind of like an egg white, and it's really slippery, and it lubricates and nourishes the joint. Articular cartilage, you guys are familiar with. In some joints, we have meniscus, which are little pads of fibrocartilage. You've probably heard of someone tearing their meniscus in their knee, very common, but meniscus are just supposed to absorb the shock. Tendons attach muscle to bone, and ligaments attach bone to bone. These two are often mixed. So the articular capsule here, if we look closer, has a fibrous layer and the synovial layer. This synovial layer, the goal of this is to just produce that synovial fluid that lubricates and nourishes the joint. Other things, bursae are little fluid-filled sacs that are between the bone and the skin, bone and tendon, bone and bone, kind of depends on the situation. So here this bursae is between a tendon and the bone here. You guys may have heard of bursitis. Anytime you see itis at the end of a word, it means inflammation. So bursitis is inflammation of the bursa. When this gets inflamed, it starts to rub against the bone and the tendon, and that causes a lot of pain. Another similar synovial membrane is called a tendon sheath. So wrapped around your tendons are these little tendon sheaths that have synovial fluid within them, and they allow the tendons to glide nice and smoothly without rubbing against the bone. If the tendons get inflamed, we call this tendinitis. You guys probably have also heard of that too. Here's just a picture looking at different examples. So you can see the bursae here, the tendon sheath wrapping around all of the tendons. So we'll go through each of the different types of synovial joints. So ball and socket joints, literally a ball in a socket. So this is your humerus into your scapula in your shoulder, or your femur into your os coxae in your hip. Okay? These are multiaxial. These can move in all directions. Hinge joints. So this is like your femur and your tibia and your knee. They move in one direction. You can flex and extend from that joint. Saddle joints kind of look like two horse saddles. And this allows us to move in more than one direction. So this is how we get our thumb. That is what makes us primates. Pivot joints allow you to pivot, so one bone stays in one place and the other, they just rotate against each other. So the radius has a flat head to it, and it just moves, it just rotates on the humerus, which is here. This is what allows pronation and supination to happen. Gliding joints are two flat surfaces. This is like in between the bones in your wrist and the bones in your feet, and then between your sternum and your clavicle. So there's not a whole lot of movement here, and it's in one direction. Condyloid or ellipsoid joints are convex surfaces, and these kind of rub nicely against each other. So these are like between your radius and your carpals, or between your carpals and your metacarpals, or another example is in your head with the articulation of your skull to your first cervical vertebrae in your neck. So inflammation of the joint is called arthritis. There's two different types of arthritis, really, really important. These are good exam questions. Osteoarthritis is normal wear and tear on the joints. This just, kind of happens as we age and degenerate. When bones start rubbing against each other, they start growing bone spurs, and then the bone spurs rub against each other, and that causes a lot of pain and inflammation in the joint. Rheumatoid arthritis is completely different. It is because your body thinks that you have foreign materials in your joints. So your body has a very sophisticated immune system that recognizes foreign cells and starts to attack them. This is great, except in some autoimmune diseases like rheumatoid arthritis, where your body starts attacking the synovial membrane because it labeled it as foreign for whatever reason. So the body itself starts to degrade the synovial membrane, and then the bones actually ossify out of place, and I'll show you a picture of that in a second. There are treatments available for this. Steroids and aspirin control inflammation, but there's actually some fancy new medications that can block the antibodies. So they bind to these antibodies to prevent the attack from happening. Pretty cool class of drugs. They're called monoclonal antibodies. If you're curious, I'll write it down here. Monoclonal antibodies. You'll see them as MABs. Here's a picture looking at osteoarthritis in the hip. You can see the cartilage is degrading. This is normal wear and tear, painful, but it's, part of aging. And then rheumatoid arthritis, this is the autoimmune disease where the body's attacking its own joints. And you can see here these bones have ossified, kind of not in the right place. The reason we see this very prominently in the hands is because you have so many joints in your hands that you use frequently. Rheumatoid arthritis can happen anywhere in the body. It's just not as noticeable because the other joints aren't as many in terms of number. Okay, so that is it for this unit. Let me know if you guys have any questions.